morning, everyone. We'll take let a couple seconds roll by so that people can still get logged in. We are so excited to have you. Thank you all, especially for the folks in the Central and Mountain time zone, rolling out of bed, getting ready for some legislative talk. You guys are the true champions of this morning. But I am Ben Connor, CEO of Connor Insurance, and I am pleased to be here today with Mike Hill of Total Control Health Plans and Jessica Waltman of MZQ Consulting, here to talk about highlights from the new transparency rules and legislative updates. This is our fast and furious session. Just so you all, just to give you a little bit of background, since the end of 2020, we've had Republicans and Democrats working together to both pass equally interesting legislation and stimulus packages that include a ton of benefits regulations. In fact, I guess Jessica can give us some insight to this, but maybe it just depends on if you print on one or two sides, but it's close to 1,000 pages of regulations specifically devoted to benefits regulation. And that's what we're here to unpack. Obviously, we all want the highlights, what matters to us as employers as we navigate this year and into the future when it comes to health plan compliance and employment compliance. But we're so pleased to have you today. So I wanted to introduce my colleague, Mike Hill, to give us the rundown of what we're going to do today and to introduce our speaker.
Awesome. Thanks so much, Ben. It's great for the Total Control Health Plans team to be with you guys this morning, our friends from to the South. Want to introduce Jessica Waltman, who is the Vice President of Compliance with MZQ Consulting. She is one of my favorite people to talk to as a poli-sci major myself. She always knows the inside baseball of what's going on in DC, and so she's a lot of fun to talk to, and just a wonderful personality at that as well. So what we're going to do is we've got a number of different topics to get through, and we're going to turn it over to Jessica to hit a particular topic, such as the first one we're going to dive into is this pricing transparency. At the conclusion of that topic, we're going to open it up for Q&A. So throughout Jessica's remarks, you're welcome to submit questions in the Q&A section, and then we'll dive into those at the end of each segment. The second half of our talk this morning is going to get a little bit more lightning round mode, where we're going to hit a couple key topics very quickly and then wrap it up with Q&A at the end as well. So for those of you that received the emails that we sent out, we were talking about what could be bigger than the Affordable Care Act. I mean, that seemed like that was the biggest piece of healthcare legislation in decades to hit the United States. From my perspective, from Connor Insurance's perspective, this pricing transparency legislation, which hasn't gotten a lot of press, we think is going to have a much bigger impact on employer-sponsored plans than the Affordable Care Act did. And so with that, let's dive into pricing transparency with our good friend, Jessica Waltman. Jessica, the floor is yours. And you are muted still.
Sorry, I'm having trouble with that this morning, so hopefully I've stopped. I'm going to share my screen. And so we can get started. And as Mike mentioned, we're going to talk about a lot of different requirements relative to price transparency. So we're going to hit, so price transparency, kind of a big overview, overarching category, but then we're going to just kind of split out the pieces so you know about all the different parts, because as Mike mentioned, it's not really getting as much press as one would think. I mean, I don't know if we're just all tired with COVID or that's just dominated everything, but really it is more pages than the ACA. It has more provisions. It's going to change a lot. And also, it's going to change things faster than the ACA did. We all knew about the ACA. It built up over a couple of years to pass. And then most of its provisions didn't take effect until over 3 years later. And there was a lot of prep work beforehand. This stuff is all either in effect now or coming into effect by the beginning of next year. So we don't have a lot of time. So we want to make sure you're briefed on it and just get through all of that. So everybody on this call knows where things are going. Wayne Gretzky said, I'm going to paraphrase here, but that he always skated to where the puck was going. And we want you to be able to know where the puck is going in just a few short months, because it seems to us like a lot of people aren't really paying attention. So let's get started with that. And we're going to start with just the true price transparency piece of the regulations and legislation. And first, I do want to just give you a little inside baseball of how we got through this. And everybody's politics are determined by many, many factors, and certainly not all what we have to do for work. But I will tell you that everything we're talking about today is bipartisan. It started under the Trump administration and it is carried through to the Biden administration. And that's important on two fronts. First of all, you might get scared or mad about some of this stuff, and you can just blame everyone. When my little boy, who's now 11, was 2, he used to say a lot, I hate everything. And if you are just kind of shocked by this, it's equal opportunity. So just there's no one to blame, or everyone to blame. And then the other thing that makes that important is because everyone was for it, it's probably going to stick. But let's just kind of go back to where it started. Really, actually, I start with President Trump, but really it goes back to President Biden. President Biden now, Vice President Biden then, and President Obama, because all of this transparency stuff is based on some provisions in the ACA. So the legal authority for all of this regulation stems with the ACA. So we passed the ACA in 2010. And a lot of times people said, well, it's the Affordable Care Act, but it didn't talk about cost containment. And that was kind of a message point. True. Well, President Trump said, all right, we're going to do something about that. And in 2019, he issued an executive order and said, we have to disclose prices, and that will transform the market. And he did an executive order, and it wound up being 2 different regulations. And regulations have the force of law. They start with a law. In this case, he took the ACA. He found legal authority in that law. And then this is kind of the details, the roadmap for the administrations. And they adopted these rules, and they have the force of law. So the first step, which is already in effect, was to require hospitals to disclose the prices that they are paid from all payers. And they had to put that information in machine readable files and on their websites, and it's out there now. And they have some more steps that they have to go through, but that's out there right there today, and they're going to work on their next steps. We're not going to concentrate on that because we are talking about health insurance. And I could just keep talking about hospitals, but the thing is, there was phase 2, and it focused on both health insurance carriers and also group health plan sponsors. So that's any employer that sponsors a self-funded or level-funded plan. It applies to all of you. And it applies to people that sponsor fully insured health insurance products too. And it just also places responsibility on their carrier. So all of those groups, everyone on this call, it affects us. And it was finalized this October. They like to finalize things right before a holiday. So you can see it was October 29th. So all of us parents, that's right before Halloween. So it kind of scared us. And the first major deadline for it is this January. And I know it's going to surprise you, but it's not something that you can just roll out on January 1st without thinking about it ahead. It requires some prep work. So that's why we're talking about it now. So that plan transparency rule applies to all kinds of groups. It really excludes non-grandfathered plans because remember, its authority comes from the ACA. So if you still have a grandfathered health plan, you don't have to worry about this right now, but there's not that many of you. So if you have a fully insured plan that's not grandfathered, level funded, self-funded, any type of major medical plan, it applies to you. It does exclude your HRA, and it does exclude things like health FSAs and accepted benefits, short-term limited duration plans, things like that. But any health plan that is basically subject to most of the ACA provisions, so really all of them, like not a grandfather plan, that's who we're talking about. And this is important to know because it's just kind of interesting. If you offer fully insured coverage, you share liability. You don't get rid of your liability, you share liability for doing this with your health insurance carrier. The rule says that you can try and get your carrier next year when you renew with them to take your liability or do this for you. It specifically is written so that the employers can charge you a fee to do this. So my guess is, because when I get into what we have to disclose, you're going to be like, I don't have that information. The carriers have to do this for me. You're probably going to want to try and seed or come up with some type of contractual arrangement. And that's why great brokers, like the ones that are putting on this webinar, are so important because they know this. And they're going to look at your contract and factor this in now. And they're telling you to do it. So we can look at your liability and make sure that it's in your contract and that's getting done for you. If you are self-funded or a level funded plan and you work with a third party administrator or other administrative services entity to process your claims and do all of that, you're the only one with liability. You have to do this. But as I'm about to describe to you, you're not going to be able to do it without help. You're going to need your TPA to do it. They probably will be willing to assist for a fee because if they don't, you're going to have to probably take your business elsewhere. And that's why you should probably be talking to them now. But they don't have any direct liability, so it's your job to make them, and it's probably going to cost. So it's going to cost both you if you're in fully insured or self-funded, and you're going to have to make sure that it gets done in either situation. It's just a question of who ultimately owns the control. And if you self-fund your plan, you already know you have more control with your design and things like that, but you take on more liability. So there's benefits and risks. So it's just really the same as where you already are. The most important thing is knowing about it and looking at those contracts, looking at those ASOs, and going in now. Because I can tell you a lot of TPAs haven't really thought this through yet. So if you go in ahead of time and say, all right, this is what we're going to need to do. How can we work with you? It's going to be probably a lot better than if in December the TPA comes to you and says, hey, you need this, and this is how much it costs, and you don't have any choice. So that's why we're talking about it now. Okay, so the things that you have to do first, which is January 1, is you have to have 3 machine readable files on your website somehow or linked to the TPA. There may be different ways to do this, but you have to have it out there in the public. And the 3 different files have to disclose 3 big different categories. The first one is all of the in-network rates that you have negotiated or your carrier has negotiated or your rental network has negotiated for you to pay providers, everything that they pay for all the services. Then you have to have a separate file that gets it for what they've been paying out of network. And this one is trickier because it really needs to be maintained because they're looking at what you paid historically in the past, and you have to look back at that. So they're going to need, if you have a January 1 plan, to start looking back this July and August and give kind of averages. And because we have to worry about people's privacy, all of this has to be de-identified. But with those out of network claims, they don't have to put them if there's kind of less than 20 claims in a particular category, because you might be able to figure out who it is depending on the size of the group. So the TPA has to be really good, or the carrier has to be really good there to suss that out. And since people's claims volume vary from month to month, they're going to constantly have to be looking at that and seeing which out of network claims meet that threshold and disclose exactly what they paid people. And then the third file is all of the prescription drug cost information, what the drugs really cost, what the rebates are, all those things. It has to be maintained and updated monthly, and it has to be fully updated and accessible to anyone. Now, these files look crazy. You're not going to be able to read them and look at them yourself and make any sense of them, but there are data miners, smart people, companies that are going to take this information and use it, and they're going to know what everybody pays. And so that has the potential to be very, very transformative in our market. It's just right away, it's not going to be super useful to you, but eventually it's probably going to change market behavior. So that's the first requirement, and that's from the rule. The second part of this rule comes into play for plan years on and after January 1, 2023, and then 2024. And it's the same requirement, you just have to disclose more. And this is something that, again, you have to have on your website. If you have a portal for your plan, it has to be kind of easily accessible for people, link to a TPA website, but it has to be something that the plan beneficiaries can get at. And this is only for people that participate in your plan. So your employees and any other enrollees. And you have to have a tool up there, and it has to be individualized, personalized to them. So if I look at it, I'm looking at things for my family. If Ben or Mike looks at it, they're looking up things about the Hill family. So it has to tell me what my out of pocket, where I am at that for my family, where I am at my deductible, and it has to be specific. And I can look up any service that I want. The first year, it's 500 shoppable services. So common things people go to and might get ahead of time. And then by 2024, it's all services. And you have to be able to search it by CPT code, which is the medical billing code. So, not anything that you would know, but your doctor would know. Or you have to be able to search it in plain language. So if I am at night, have a child, and they're coughing, and it sounds like croup to me, but it could be strep throat. But I'm paranoid, so it could be throat cancer. I could go online to my tool and say, okay, if I need to get someone treated tomorrow for croup and go to a regular pediatrician visit, what does that cost me? What if I go out of network? What if I go to a different provider? What's my cost sharing going to be? How's that going to affect my maximum out of pocket limit? Do I have any step therapy things? Do I have to get it pre-authorized? All of the things specific to me. And it also has to tell me what they would pay, that negotiated rate. So not just my cost sharing, but what the health plan would be paid and what the health plan would pay the doctor. And if there's any underlying fee schedule. So I get to see all that information too. And it has to be specified to me. So first I think it's croup. I need to go to the pediatrician. Then I think, oh wait, you know what? Maybe it's strep throat. So maybe I'll just take them to urgent care or to CVS to get a rapid test. Or maybe I think there's a pediatrician right down the block, but they may be out of network. What does it cost? Oh wait, now I'm paranoid and I've decided that maybe my child has throat cancer. Let me look and see what would all the costs be for that. And then somebody comes to me and says, go to bed. Nothing's getting solved tonight. Turn off your tool. But the thing is, all this information has to be specific to my family at the ready. And if I don't want to use the internet and I'd like to call and talk to somebody on the phone or fax them or, send in an online request or somehow get to them outside of looking it up myself, my carrier or TPA has to be able to send me a written estimate to me within 2 days. Now, the good thing is they get to cut you off and they can say after 20 iterations of this, they say, okay, you're kind of a hypochondriac. We're done with this. We're not making up, 20 variations of throat cancer, but that's in writing. But online, you can look as much as you want. And those have to be available to all of your plan participants specific to them. 2023 for 500 top services and everything covered by 2024. So that's the rule. So that was the Trump administration's part of it. Then to layer on, because like I said, everyone loves transparency. It is like the kittens of the healthcare world or the puppies. No one is against it. Everyone thinks this is great to know what costs are out there. And they're right. It's just complicated for people like us to make sure everyone gets that information, make it all happen. So we continued this theme. So as you might remember, in at the end of the year, we had a COVID stimulus bill. And it was actually signed into law by President Trump on December 27th, 2020. And all the deadlines in this law are either 1 year after enactment, so next December, or on or after January 1st, 2022, if it applies to a specific plan year. The liability is exactly the same as in that rule. If you are self-funded, it's technically all on you, even though you can't do it yourself. So you have to make your service providers help you with this. And you have to look at your contracts in this coming year to make sure it's happening, and you have to be prepared to pay for it. If you have a fully insured plan, you share it with your carrier, and you're going to need their help. You're going to need to look at your agreements and your renewals next year to make sure it's in there, and you can expect to have a tacked on fee. So that's again the same thing as before. And it has its own price transparency components in this rule and a lot of other stuff too. So I'm just focusing again on this just general get the prices out there. So first of all, next year, all of our ID cards are going to look totally different. I don't know whether they're going to get like the COVID vaccination cards that are like a little too big for everybody's wallet or what to fit this on here. But now they're going to have all of our deductibles on there, our out of pocket maximums, and more information like better phone numbers and web addresses for getting assistance to contact in-network providers. So we're just going to have to put more on there. It's a little more detailed than that, but that's the basics. The other thing that they have required us to do, and this is kind of a precursor to that big data disclosure for all the plan participants, but this starts again this January, so we have to have it ready. If you or I are at the doctor and we know we have a procedure coming up, depending on what it is, we can either ask our doctor to get us for this, or we can call and get it ourselves or go online and get it ourselves. And depending what the procedure is, they have 1 to 3 days to get it for us. And they have to give us a personalized estimate too, where they have all of it's a little different than what I just outlined, but again, it's specific to me or specific to you, where you are in your cost sharing, a good faith estimate of what you're going to pay, what the doctors are going to get paid, if they're in network, out of network, what they get in network, what they're estimating that they'll come up with if they, if they have to negotiate with an out of network provider, if there's any type of like step therapy, medical management, pre-authorization requirement you need, it needs to be on there, and any other information they deem appropriate. So we can get it and then it comes back to us. We can either get it online or they can provide it in writing. So it's not automatically that we can go look it up ourselves, but we can contact them and make us give it to us within 1 to 3 days. Again, you have to make sure your carrier is going to be able to do this and how they're going to do it. Or if you are self-funded, you have to make sure that your administrative service provider can do this for you, because it's not going to be there. And one of the things that I think you should look at, these contracts are probably going to tell you, and it's true, you're going to need to do it. If an employee or someone comes to you and says, hey, plan sponsor, I need this information, you're going to probably have to have in your agreement, we'll get back to our TPA like that, or we'll call the carrier right away and let them know, because they only have 1 to 3 days to do it to us. And we'll have to say, hey, call that 1-800 number or look on your card. There is that website, go there. So that is coming up. And that is kind of what we have in the pure price transparency. So now, Mike, I know, and Ben, you've got some questions for me. And what's our fast and furious? Shoot it at me.
Jessica, that was amazing. Remember, for all the attendees, just put it in the chat. If you have any questions that you have, now's the time for Q&A on the transparency rule. Mike, what has jumped out to you as you've listened to this first section?
Well, it takes me back in time, back to the future, when we were all gearing up, getting ready for the ACA reporting that employers had to do, the exchange notices that employers had to provide, the penalties that employers were going to have to pay. We were all gearing up, ready to go. And then at the 11th hour, the government punted on this. So what is the likelihood that you think the government's going to punt, Jessica?
Well, it's a really good question. So in this particular stuff, the government, we have 2 things to look at. One is the hospital stuff, because the hospital has already had to put out in machine readable files their price information, and they didn't punt on that. And they didn't give them a ton of guidance. I mean, they just said you have to get it out there, so that they do have it out there in different formats. It's possible that they're gonna be looking at that and saying, "Hey, I don't know if it's like super useful the way that they did it with the hospitals. We'll give some more guidance," but we haven't heard on that yet. So this regulation stuff, I don't know that they're going to delay it. It has the dates in force. They might say we're not going to enforce it, but it's kind of out there. So the other thing is because it's bipartisan and both administrations like it, they, the likelihood that it will move forward on the regulation side is pretty good. The one thing that's kind of interesting is, remember I said the regulation, not that Consolidated Appropriation Act stuff where they have to have those 1 to 3 estimates. So just like that very last segment, but all I said about the machine readable files and then the shoppable services and the paranoid mom stuff, that's all based on the ACA. So it's kind of interesting because the Trump administration did all this based on the ACA's authority, and then they challenged the ACA in court. But we are going to get a Supreme Court ruling probably at the end of June on the constitutionality of the ACA. And if they strike down the whole law, this will go too. So that will just get rid of it. If they do something like kind of come up with a compromise position, which a lot of people think they will, and just kind of strike out the individual mandate, it won't affect this. But if they say we are striking down the whole law or anything really, this comes from the exchanges part of the law, ironically. If any of that goes, this could go too. I don't really think that's going to happen, but it's possible.
So you mentioned what was the requirement for hospitals of releasing their prices and putting it in a format where people can download in a machine readable fashion. Mike and I have been talking about this, and we have seen a hospital system that, in my opinion, is actually really trying to be the best version of that. And then another hospital we have an example of, you can decide for yourself what version of themselves they're applying towards this. But really fascinating, Mike. Would you mind sharing that?
Sure. Thanks, Ben. So our friends on the east side of Michigan at Beaumont Hospital have published their pricing for every one of their locations. And the thing that's mind-blowing is that if you've spent any time around health plans, specifically self-funded health plans, you've heard the discussion about discount. And this is for Beaumont Dearborn Hospital. And this is just going to kind of show you what a farce the whole discount concept is. And also why this legislation, while overwhelming, and this rule is overwhelming, is going to so simplify things over time and bring so much more clarity to employees and employer plan sponsors. So this is just a Excel spreadsheet that they posted. We've got all the different services they offer, all the DRGs here, diagnostic related groups. So if we take a look at ECMO, for example, they've got their price is $449,000. But the minimum price for it is $73,000, and the charge might be as high as $574,000. If you're paying cash, it's only $107,000. But then if we start looking at the various payers, so Aetna's HMO, what Beaumont charges their HMO is $221,000. But if you have the Aetna PPO, they're going to charge you $369,000. But we don't know what the discount's going to be. ASR, a TPA based in Grand Rapids, they only pay $315, but Blue Cross gets charged $240 unless you have their HMO. Or what if you have Cigna, or you use Cofinity, or what happens if you use on and on and on it goes. But at least they've put this charge information out there, but this does not get down to what your plan actually pays. So that's one example. But then taking a look at our friends to the south at Indiana University, they post this information on their website. And here's our standard charge listing. We could pick any location we want. And CMS requires that they publish a comprehensive machine readable file, and that's the operative words right there. So let's take a look at what IU's definition of a machine readable file is and see how helpful it is. There you go. What do you think about that, Ben?
My goodness. I mean, there's a couple words in there you can pull and some percentages here and there and even some acronyms. So
that's right. Looks like Humana Choice Care has 83% of something.
That's incredible. And I think what's interesting, Jessica, to your point, is it's baby steps, right? So we started there, and then there's expansion to price transparency and actually getting it into consumers' hands. We do have another question from the Q&A box. So one participant asked, I just want to verify that grandfather plans are excluded from all price transparency requirements. If so, is there any discussion to mandate grandfathered plans to comply in the future?
So first of all, it should clarify that the grandfather plans are exempt from that machine readable file, and then the database kind of online linked specific to your plan participants. They're not exempt from the Consolidated Appropriations Act because that's not related to the ACA. It's a new law. And so they do have to have those other estimates available. And then again, the regulation, when you do a regulation, it's kind of like the law is the walls of the house, and then the regulation is all the like furnishings inside, right? And details inside. And so the rule on the price transparency in terms of the machine readable files and the other disclosures are all based on the ACA. And so since grandfather plans are only subject to those limited parts of the ACA, they can't really do that. They would have to pass another law to target grandfathered plans. And so, I mean, they could be like, it's hard to say, but since there's not as many grandfathered plans, like I'm not sure the Biden administration is going to go after grandfather plans given all of the history with the ACA, but maybe they will. I mean, but they would have to pass a law. I mean, also just Congress doesn't pass that many laws anymore. So that gets in there, it's kind of small odds.
So Jessica, one point though, my guess is that the person asking the question is very familiar with what it takes to maintain a grandfather plan. But just as a refresher, the changes that will trigger the loss of grandfather status are cumulative. And so over time, little minor changes may ultimately push you over the edge and you'd lose grandfathered status at that point, correct?
Yes, you can change. Yeah, it's not, every successive year, it becomes harder to keep up your grandfathered plan status. And once you lose it, then you're subject to this.
So typically, Jessica, when regulation is passed, you either comply or there is a penalty. What penalties come with non-compliance of the transparency requirements?
So basically, we're all subject to this kind of same penalty level for maintaining a compliant health plan. And so the federal government just kind of lumps all this stuff together under ERISA, or if you're not in an ERISA plan, there's other means to get at you. But essentially, most employer group plans are subject to ERISA, and they are to maintain a compliant benefit plan. You're subject to penalties, and they're based on like between $100 and $114 a day per affected beneficiary if you're not compliant. So if you think about affected beneficiaries, that's all the belly buttons on your plan, not just the employees. And per day of non-compliance could technically be what you would have to pay if you didn't do this. Now, in theory, usually the Department of Labor and Department of Health and Human Services are all about getting you back into compliance. So they're going to do corrective action, but you are going to have to do this. And I mean, again, the other thing that it's going to push on you is if you don't do this, then every carrier in the country is also subject to their own liability for not doing this. They could lose their license, they could not be able to do business. So if you're fully insured, the carriers are going to have to do something. They're going to pay, but you're going to have the whole fully insured side of the business doing it. And then they're going to do it for their, if you have a fully insured plan that has an administrative services arm, they're going to do it for them and charge. And so then it's going to get into the independent kind of realm. They're going to have to do it too. So you're kind of going to have to go along. Like if your independent TPA is not doing this, they're going to lose their business because, everybody else is eventually going to do it. They're not talking about it yet, but behind the scenes, they are starting to panic and try to figure out how they're going to carry this out because it is fast deadlines.
And one thing to add to that, and I think, Ben, I saw a question come in for you too. But we've been talking to the TPAs we work with, and if you're a Blue Cross Blue Shield or a carrier that owns your own network, this is an easier lift for you than an independent TPA because they are needing each network they contract with. And if a TPA has business all over the country, it could be dozens of networks to tell them what the negotiated rates are, not the charged amount, but what actually the plan would pay. And so the TPAs are starting to ramp up and do what they can to poke their PPO network partners to get this information put together. And it's a lot of stuff to do in the next 7 months.
Yes.
Absolutely.
Yeah. And one other thing about like delays and stuff. So the federal government likes to delay things that affect them, like where they have a piece of the puzzle to deal with. In this particular case, these disclosures are on us. And so since they don't really have to do anything per se, the likelihood of delaying it is less. It's only if they get significant pressure and feel like they don't have to. Like the reason why the employer mandate was really delayed was because they had to have a system in place to get the employer reporting come back to them, and they hadn't figured out how they were going to build that yet. So they just bought themselves a year's worth of time. This is kind of the same thing. Like they don't really have anything that they have to take in. Some of these other requirements, they do have intake on their end. Those are the ones I'm like, think could get delayed a little more.
Yeah, you know, a takeaway from this segment, Mike, that I've been really thinking about is, and you just as much as us, Mike, we're very involved in the healthcare and broker community, and I am just floored that no one is making a big deal about this, because there's two components to it, in my opinion. There's the opportunity for information and to assist employees with quality information to actually make a decision in regards to healthcare, rather than like pick someone out of the network directory, which you're going to get the best physician from that facility and you're going to get the worst, which that's a terrible way to choose a physician, is just from a network directory. So there's that positive opportunity, but we also have all of these requirements that is the employer's responsibility. I'm just totally shocked that no one in our community is really talking about this at this point. So, you know, I'm pleased to be partnered with you, Mike. I know that we've had a lot of information coming back from TPAs about what their expectation is in response to this on the TPA side. So I think we had a question come in from the chat about what should we expect outside of education from our partners at Total Control Health Plans and Connor. It's that not only are we going to educate you about what's going on, but we're working with our TPAs and our insurance companies to make sure that we are very well prepared, you know, to Jessica's point, ahead of November, right? That we know what that landing area looks like, so that we're very prepared, and that we know we're asking the right questions, and having everyone do what they're supposed to do. So we have full confidence in that. You know, I know from a national perspective, Mike, you and I are going to be making some noise in the broker community to get on it, but that's just kind of an interesting takeaway from my perspective.
Yes, and the last little comment I'll make on this, and we'll move on to the next segment, is that this seems daunting. There is work for employers to do, but the market is going to respond and we will solve these problems. And at the end of the day, we are all going to be in a far better spot. Imagine the days of talking about network discounts going away. We never have to talk about network discounts again. We know exactly what we're going to pay. Our plan is going to pay before it pays it. So much more transparency. We're all about control and managing the healthcare supply chain. And this has been a missing component to that. So while yes, it's going to be hard before it's easy, it's well worth it in our opinion.
Yeah, that's interesting you bring that up, Mike, about the business side of this. And there's erosion in value of network discounts if it's actually disclosed and people know what the prices are, because if you know what the facility is willing to accept, then it really compromises the value of a network, because you know where to start from or where to end. You know what's willing to be accepted. So that is interesting. I guess if there's any delay or pushback, there's going to be strong lobbies out there maybe that don't want something like this to happen.